Now, members of the Kenyatta National Management staff have been meeting doctors' union representatives over the suspension of KNH staff members due to performing surgery on the wrong patient. NTV's Eunice Omolo has been following this particular story. Any information as to what has come out from the meeting or if it's going on?
Thank you very much, Mark Masai. The meeting, as we understand, has ended, and we're not yet sure what was discussed and what they came up with, but what we're sure of is that there's a special council that was formed to address issues affecting patient-doctor relationship in the hospital and the systematic problems that seem to be eating Kenyatta National Hospital. And as we are aware, at this point in time, we have the rights of the neurosurgery registrar suspended. We also have 2 nurses who've been suspended, and an anesthetist who has been suspended as well. And with me, I have this General Secretary of Kenya National Union of Nurses, Mr. Seth Panyako, who is going to help us understand exactly what role these 2 nurses played in terms of tagging, identification of the patient, in what has turned out to be right surgery on the wrong patient.
Yeah, first, from the onset, I want to say that as a union and as a leader and as a Kenyan, I don't, under any level, condone or sympathize with any level of professional negligence, because professional negligence causes death. I have always said from the beginning that my hospital of choice is Kenyatta National Hospital. If I fall sick today, I'll be admitted in Kenyatta National Hospital because I don't have any medical cover. Kenyatta National Hospital, the hospital for the poor like myself. Coming back to the question, the role that is played by nurses is, first, the doctor will have to identify the patient. Say that this patient is going to go to theater. Now prepare this patient. So when it comes to the issue of patient identification, the first health worker who is supposed to identify the patient is the surgeon who is going to operate on this patient, because the surgeon must come to the ward, assess the patient, and give direction that prepare this patient for theater. Once that has happened, the nurse now will prepare the patient, and one of the role of the nurse is to give identification tags to the patient. That's the role of the nurse. Whether the nurse did it or not, whether they were done wrongly or not, we cannot run away from our responsibility because things have gone wrong. That is the role of the nurse, to identify the patient and to ensure that the correct patient is taken to theater. But that is done after the doctor has said this patient should be prepared. So the question we were supposed to ask here, did the doctor review that patient prior to theater, like 15 minutes to theater? Did the anesthetist review that patient prior to the theater? I want to say clearly that I'm not blaming the doctors, I'm not blaming the anesthetist, I'm not blaming the nurse. The public healthcare system has got a systemic problem. For example, it is only in public healthcare systems in Kenya where patients are not tagged. This is a patient whose decision to go to theater was made in casualty. Now, if it was made in casualty, the thing is the patient should have been labeled in casualty. And when the patient is brought in the ward and has stayed more than 8 hours, and you want now to go to theater, the 2 professionals, the anesthetist and the surgeon, should have reviewed this patient prior to theater. But I'm not trying to blame them. There is a serious problem in our public healthcare system. None of our patients is normally labeled. Like when you go to Nairobi Hospital today, any patient must be labeled.
Now, maybe finally, what is the way forward? How are we going to treat this systemic problem that is eating up our public system?
We must have a professional dialogue on these issues. We must sit down and review our public healthcare policies, because healthcare workers do not have the ability to ensure that every patient who's coming to the ward is tagged, to the hospital is tagged. That must be entrenched in the policy, must be followed by proper budgetary allocation, and we must have proper staffing. Like in this ward, when you talk of a nurse is managing 21 patients as opposed to 6 patients. This is if these nurses, we are going to sit there and we're supposed to defend these nurses, I'll be asking, can you show me in the duty roster who was responsible for this particular patient? Because they must be a nurse and they must be the number of patients that this nurse is managing. So these nurses were only in charge of 18 patients out of 63. So we want the management of Kenyatta National Hospital to tell us who was in charge of these excess patients. But I'm not also blaming the hospital, because if there's no proper budgetary allocation, the hospital is not able to have proper staffing. This is a registrar who was operating on a patient, craniotomy. Where was the surgeon? The qualified surgeon, because this one is a student. So we cannot blame the student, we cannot blame the nurses, we cannot, this is a government problem, failure to manage public healthcare system in a proper manner.
Okay.
Yeah.
Thank you very much, Mr. Seth Panyako. And Mark, I'll give it back to you, but we'll continue following up on the unfoldings of this case where a patient was wrongly operated on the brain. Thank you.